Hello, my name is Audrey Poole, and the topic I chose for my presentation is Esports Healthcare. So I first wanted to talk about the advantages to being an esport player. You can earn money, develop your gaming skills, and also develop community and team building skills. Although being an esports player does have its perks, there are certainly stressors, such as coping with defeat if you lost a competition, the demands and expectations of performing at a competition, the pressure of it, public scrutiny and criticism potentially from the media, increased stigma and gender discrimination. Could be if you're a woman in esports, online harassment, and there could be team related issues too, like conflicts and toxic behaviors of certain people on your esports team. There are certain health problems esports players could face. They could have a sedentary lifestyle from sitting down and playing games most of the day, pain in their wrists, elbows, and neck, carpal tunnel syndrome, sleep disturbances, gaming disorder, educational neglect if they started their esports career at a young age, so that stopped them from continuing their education. They could have burnout or a decrease in social relationships. I found a couple studies talking about different mental health problems. One study found that the desire to pursue an esports career and the total time practicing were negatively associated with psychological well-being in young people. And then another study found 37% of Portuguese electronic football players experienced symptoms of depression and anxiety. Other studies found high symptoms of depression in Australian, US, and Korean esports players too. Potential ways to help mental health problems, such as access to professional counseling for self-management strategies and coping, education of the esports players to risks, symptoms, and treatment for gaming disorder or addiction, help available during competitions from sports psychologists, develop measures for early detection of problematic drug use patterns by esports organizations, initiate open conversation to raise awareness and decrease stigmatization of mental health. They need a support system, and esports staff should promote mental health and create measures to detect signs of mental distress. There are also physical health concerns with esports players. 45% of Portuguese electronic football players experience sleep disturbances, and similar studies found Australian, Korean, and US esports players experience sleep disturbances too. There are different ways to help physical health of esports players, such as providing information on negative consequences of extended play on players' bodies and lifestyle, making sure they get an appropriate amount of sleep, educating them on the importance of a balanced diet, and the dangers of energy drinks or other stimulants, physical exercise being made important, and esports organizations could adapt drug prevention methods to certain players. Here are some potential healthcare professionals that could be on a health management team for esports competitions: a physical therapist, a team doctor, general practitioner, sports psychologist. It can help with failure and success, provide support to prevent burnout, conduct baseline testing and clinical evaluations. Physical and mental health assessments could also be made. So for some final thoughts, I wanted to include that policymakers, gaming regulators, gaming industry, national and international esports organizations, healthcare and treatment providers, researchers, and potentially others need to work together to ensure optimal harm minimization. Policies need to be made that address problems and risks, plan action, and designate organizations to implement policies. Overall, more research needs to be conducted in esports since it is a fast-growing industry and esports players are experiencing health concerns.